can legally inject a peptide into yourself, but let someone charge you to do it, and they might be breaking the law. So where's that line? I'm Dr. Kate D., founder and medical director of Glow MediSpa, and this is MedSpa Confidential, where we expose the risks, the red flags, and the outright illegal practices happening inside med spas right now, because you deserve to know what's actually going into your body before you say yes. Today, I'm sitting down with Dr. Flora Waples. She's a physician in Colorado who runs multiple med spas and prescribes peptides to her own patients. Her son needs growth hormone daily, and she lives this on both sides, as a doctor and as a parent. You'll find out which peptides actually hold up under real science and which ones are running on hope. We'll get into why so many people are buying these straight from China and why that's a dangerous bet. You'll hear how a Seattle patient nearly died from something sold as one drug that turned out to be another. And Dr. Waples tells you the proof you should demand before you let anyone put a needle in you. Stay until the end, because there's a change coming this summer that could shift this whole market, and you need to know why. Flora, thanks so much for being back on the podcast today.
Oh, such a pleasure to be here again.
So we're always talking about these sort of edgy topics. So do you want to just, so I did talk to someone recently on the podcast about peptides, and we just didn't really cover it. And I would love to talk about just the different ones that are popular and what they're supposed to do and if there's any science behind them. And then I do want to get to like just exactly, how illegal are they?
It's always funny when that's the question. Not are they illegal, but how illegal?
But let's just dive into like the most popular one. And I would love to just know your take on it. BPC 157.
Before we jump straight into peptides, if it's okay with you, I want to start off with a little bit of definitions, because there's a lot of confusion, or not necessarily confusion, but what are peptides? Let's start with that. So the word peptide just means string of amino acids, right? So that word is not how it's being used when people talk about sort of the fact that peptides are hot nowadays, right? So what people are talking about when they use the word peptides sort of, let's say colloquially nowadays in social media, what they're talking about is a specific group of peptides that our body makes that it uses to signal, turn on and off different functions inside our body. So they are the subset of peptides that our body can make that's used to signal, turn genes on, turn genes off, stimulate tissues, suppress tissues.
Right.
Peptides are hormones, and this is another place where people get confused a lot with definitions. A hormone is loosely defined as a signaling molecule that affects lots of different genes, hundreds of different functions. So something like estrogen will affect hundreds of genes. Peptides can be hormones. Hormones can be peptides. There are several peptide hormones. Some peptides will only affect a very small number of genes and functions. Some will affect a larger number of genes and functions. So there's a lot. So when I think about what are peptides, when I think about them, they are in the same category as hormones in that they are signaling molecules that can influence what our body is doing at any given time. And what it influences depends on which peptide you pick. So I always want to just start with that kind of like rough definition. It is a signal your body uses to do something that we are harnessing for whatever we want to do. So start with that. That being said, BPC 157, fascinating compound. I like to start by talking about what is the base molecule? Like, where did it come from? How did it get found? Then we can talk a little bit about mechanism, but some are known, some are not. We'll kind of, as we go through, then we'll talk about what type of literature do we have? Do we have animal studies? Do we have human studies? Some combination. Aside from the, sort of cell culture level stuff, what do we have on this? And then we can talk about regulatory status on last. But BPC 157 was originally found, I think this is such an interesting origin story. I don't know exactly the times when this was done, but pre-modern surgery. People realized that when people had very bad penetrating trauma to their gut, people whose stomach was ruptured healed better than people whose stomach was not ruptured during that, traumatic event. And when people, sort of then enter modern science.
Which, by the way, is counterintuitive, right?
Counterintuitive,
so when you
yeah.
stab your stomach or other parts of you inside your body, you would not anticipate that would be better than not leaving your stomach intact.
Because the stomach is full of food and bacteria and acid, you would not think that there would be anything beneficial in there.
Very strong acid at that. Yeah.
Very strong acid at that. But it was noted. It was noted in sort of battlefield surgeons noticed this. So enter modern science. People took gastric juice and started looking, for compounds that were responsible for healing. And they came up with a handful. And if you think about it, it makes really good mechanistic sense. Your stomach is subjected to almost otherworldly layers of stress every day. I mean, mechanical stress, we eat things have sharp edges, crackers and things like that. Like you said, it's essentially battery acid, and our stomach has to constantly be healing from bacterial, and viral stimulus, from mechanical stress, from acid stress. The tissue in our stomach has to be incredibly good at healing just to survive, right? And it turns out that our stomach and our gut makes this compound and they named it body protection compound. BPC stands for body protection compound number 157. They found it in gastric juice. And it turns out that it does promote healing in the gut. That's been pretty well established. What they then did to make it into the peptide that we know now is the problem with peptides, or one of the problems with peptides, is they tend to be very delicate molecules. The body uses them in very, very short bursts. It makes it sends it out, usually very close to the target, sends its message, and it degrades very quickly. Well, that doesn't work for a medication. So they had to make some changes to the compounds, make the linkages stronger so it can last longer, so it can deliver a longer signal. So BPC-157, while people will say is something that's natively found in your body, that's not exactly true. The molecule from which it came is natively found in your body. BPC-157, not natively found in the body. But that's where it came from. How does it work? What mechanism do we have? Well, we don't know exactly what the mechanism is. We know some pieces of it. It seems to be pleomorphic. It seems to bind to a variety of receptors. We know that it interacts with angiogenesis, which is the building new blood vessels. So, for example, we know that when it binds to, there's a molecule called VEGF, which it stimulates, and it creates the formation of new blood vessels, which is a very important part of our healing cascade. So we know it does that. We have pretty good mechanistic data on that. It also has a second function, which is fascinating. And I actually didn't even know any of this until I got into peptides. But in order for us to heal, one very important function that has to happen is our fibroblasts, which are the cells that are responsible for making collagen, elastin, and building all the springs of the mattress, if you will, the molecules that are responsible for kind of holding our joints and tissues together. In order for those cells to work, what they do is they lay down what's called this fibrin skeleton. Basically, you can think of it like the same as construction workers that are building a skyscraper. The first thing you do is you build a scaffold, and then everyone can get in there and use the scaffold to do other jobs. Fibroblasts build a fibrin scaffolding, these rods of fibrin in tissue that's injured, and then other cells can use those to kind of find their way and do other jobs, like macrophages can come in and clear out dead tissue. Other cells can come in and deposit stuff. It's basically this. Well, it's a scaffold. It is a scaffold which allows healing to happen. BPC-157 accelerates that process. That's something we've seen in vitro in multiple studies. So that's the mechanistic data. There are probably other things it does too. Those are the two things that we know of that make sense in terms of what effects it has. So what does it do? Generally speaking, there's been pretty good amount of data in rats. There's been some studies in humans as well. Is when it is injected at the site of an injury or close to the site of an injury, it speeds up the healing time of that injury by somewhere between 30 and 50%. And that's been shown. They did a rat model where they were cutting the hamstring. They did a rat model where they were doing a crush injury on the Achilles. They basically clamped the Achilles tendon. And this has been shown several times in animal studies. There's very, very, very few human studies. There was one, no randomized clinical trials to the best of my knowledge. There was one retrospective study where a guy basically took a case series of his own patients, injected BPC into their knees, and they got better. No controls, we don't know. That being said, there's about 20 years of anecdotal data of people injecting this, a lot of them in the bodybuilding community, and going, oh my God, I just healed from this tear in days instead of weeks instead of months. And it is banned by all of the performance, like the Olympic committees and stuff, which also to me probably works. But that is what is known.
So are they injecting it just like in a different place in their belly, or are they actually injecting it where the injury is? There's no reliable way to know if a med spa is following safety standards or cutting corners until now. The Med Spa Board certifies clinics that prove they're doing things right, verified products, licensed staff, and actual medical oversight. It's the difference between rolling the dice with your skin and knowing exactly who's holding the needle. If you're looking for aesthetic treatments, Go to medspaboard.com to find a certified spa near you. And if you already have a med spa you love and they're not certified yet, please send them our link. Med spa owners, getting certified does more than build patient trust. It should also save you a ton on your malpractice insurance. Do the right thing and go to medspaboard.com. Keep listening, keep asking questions, and stay safe out there.
Great question. So BPC orients to sites of inflammation. So wherever you inject it, it's going to bind where it finds active inflammation. So in people who are, like myself, I'm almost 50, right? I got inflammation everywhere. So if I inject it, say, into my shoulder when I'm having knee pain, it will circulate through the circulation. It won't go everywhere. But if you're doing it for general anti-inflammatory and general achiness of age, doesn't matter where you inject it. If you have an acute injury, you just tore something in your leg, if you inject it as close to the site of injury as possible, you'll get more binding at the site. And so you get about 20% more improvement in the healing of an acute injury by injecting it on site. So it depends on what your application is.
Because the thing that strikes me, just because there's no study, so we don't know the answer to this, but if you have something that's doing that mechanism of action, then it makes sense to me that it's probably safe in the short term for, until that Achilles is healed. But my question is, if you're exposed to it, day after day, year after year, are you going to have an increased risk of cancer or benign neoplasm or other inflammatory things that it's stimulating that you don't need or want, right?
And we have no idea. And that is a question to which what we can say is that there have been no reported bad outcomes from anyone taking BPC over the last 30 years. Does that matter?
But who would report it if it's not?
And to where, So, we do not know what the long-term effects of there are some peptides that we have good data on long-term effects. BPC, we don't. I mean, you're absolutely correct.
Because there are a couple other ones. So the ones that work on your growth hormone axis, CJC 1295 and
the growth hormone secretagogues. Yeah.
Those you would anticipate. So if it's stimulating growth hormone, you'd worry that could be stimulating neoplasms. But again,
yes and no. I mean, so the data on neoplasms, and you'll have to correct me if I'm wrong here, but my understanding of that data is we have data on large number of animal studies that showed that increased growth hormone over time did not actually increase cancer. The one, I'm going to have to look this up and send you a link because I don't know the answer to that either. There was a theoretical consideration, and I don't know if it was ever actually backed up by science. But that being said, the data on longevity with growth hormone comes from the study of people with congenital syndromes where they are absent growth hormone. And we have a mouse model of this. And of course, we also have some human families that have deficiencies in growth hormone. And what we noticed about them is this. When people are chronically deficient in growth hormone over long periods of time, they have a longer lifespan. They have a lower rate of certain diseases, primarily in the spectrum of hyperglycemia. So they have lower rates of diabetes, lower rates of hyperglycemia. And there's reasons behind this. And this is the way that I think about it. I think of the body having, at its most basic, we've got two big ways of acting. There's two kind of paths that we can be on at any given time. And we go back and forth, right? When food is short, we are in that state of autophagy, right? We're going to be more efficient. We're going to try and be more lean. When we are in that state of autophagy where we're really trying to survive with a lower amount of food, lifespans are longer, chronic disease is put off for a longer time. However, the downside of being in that sort of fasted state for long periods of time is it's hard to build muscle and bone. And other stuff too, muscle and bone being the most important. The other state, which is sort of our anabolic state, when we have a great amount of fuel, all the fuel that we need, that's where we can make muscle, make bone, we feel great, we love it, but burning the candle that hot does lead to problems. So growth hormone is an anabolic hormone. If you're on it all the time, you're going to put on muscle and bone, but you're going to burn too hot and it's going to lead to chronic disease in the long term. Autophagy, great state. That's what your rapamycin stimulates that. That's what intermittent fasting does. That's what regular fasting does.
I was going to say, you're making the argument for living a paleo primal intermittent fasting life.
I'm making the argument that we need both states. And if you're in a catabolic state all the time, you're going to be weak. You're never going to build a lot of muscle, a lot of bone. That has problems that go along with it. If you're in an anabolic state all the time, you're going to have problems. You're going to be, hyperglycemic, and you're going to have problems there. And cycling between the two seems to make the most physiologic sense. That's where the cycling growth hormone comes from. But so the idea that growth hormone is dangerous, I think, comes from this idea that if people, when they don't have it, live longer. And that's true, but you got to look at the other side too.
Interesting. Okay. So, so those two, do you know what they're used for generally? So this CJC, 1295, and ipamorelin.
So the family, when I think about peptides, I divide them into 4 basic categories. And there's no, particular rhyme or reason, but I put them in sort of the healing group, which that would be your BPC 157, that would be your TB 500, it's your thymosin beta. And then there's, so there's the healing and repair category, which should generally be pulsed for, I would say 4 to 6 weeks in the setting of acute injury, or maybe in the setting of very hard training or something else like that, pulsed. The second category is what I would call your metabolic peptides. And I would put the growth hormone secretagogues in there and MOTS-C in that category as well. And the growth hormone secretagogues, you named the major one, tesamorelin, semorelin, ipamorelin, CJC 1295. They all have the same basic mechanism of action, which is growth hormone, one of our necessary hormones. I put it, estrogen, progesterone, testosterone, thyroid, growth hormone. It's a major hormone. And it gets released under the stimulus of something called GHRH, growth hormone releasing hormone, normally released by our anterior pituitary, and it kind of tells our body to release a pulse of growth hormone. And we generally have between 4 and 6 pulses of growth hormone over the course of a day. Like all of our hormones, it is very high when we're teens and 20s, and it goes from about 20 micrograms per deciliter of blood, I may be getting numbers wrong here, down to about 6 over the course between the ages of 20 and about 60. Our growth hormone kind of goes like that. And so when you use a peptide as a growth hormone secretagogue, basically they are GHRH analogs. They're going to be sequences of peptides that are similar enough to growth hormone releasing hormone itself that when you inject them, they will bind in the pituitary and cause a release of growth hormone. And what you get from growth hormone is the ability to build more muscle, the ability to build more bone. It has an influence on stage 4 sleep, which is something we lose almost entirely as we age, and leads to improvements in immunity just because sleep and immunity are tightly linked. And your hair and your skin look better because you're making more collagen. So it's an anabolic hormone that allows us to build. And so all the growth hormone secretagogues, they all have that same, and it also burns visceral fat preferentially. So they all have the same mechanism of action, which is they act by releasing growth hormone, which is pretty well understood, pretty well studied, and have a lot of human trials. So I put those in the category of, those are the peptides that I feel are the safest, the most well-studied, and the most well-known, that category. Mm-hmm.
Yeah, everything you've said really supports, right? Like using, if we had data to say that there were no downsides long-term, the only thing we have is, many years of unofficial use where people haven't reported super bad things.
And what we know about growth hormone is, and that we have some long-term data because there are people who are growth hormone deficient who are on it their whole lives,
Yeah.
So we know that, if it's in a physiologic range, that we haven't seen any increase in cancer rates. Like my son actually is growth hormone deficient because he has a syndrome called Arscon syndrome. So he uses it every day. And, there's no increase in cancer seen in people who are using it in physiologic levels. Now, in super physiologic levels, which is what a lot of the bodybuilders are doing, we have definitely seen megaly. We've definitely seen, the cartilage on their heads grows and their noses grow. And there's definitely some problems with that. But growth hormone, tesamorelin is an FDA-approved drug. It's being produced as a peptide, but it has full FDA approval. So those things, I would put those in the category of reasonable to use if you are choosing to do that. It's a reasonable thing to use, and it's got good human data. The downsides of growth hormone is you're going to have an increase in blood sugar. This is something that we know. If you're going to build muscle and bone, your body's going to be pulling, fuel. So blood sugar will go up. And that's something that either you manage by doing it concomitantly with the GLP-1, or you can manage it by doing it concomitantly with fasting, or you can just say, hey, I'm doing a 3-month pulse where I'm trying to grow a bunch of muscle. I'm going to roll with a slightly higher blood sugar. And usually it's like 10 points, 15 points, I'm going to roll with this for 3 months. And then I'm going to do 3 months where I'm like being really clean about my diet. I'm doing keto, I'm doing fasting, and I'm really going to make sure that my insulin resistance, is under control so you can manage it. But then the second thing is you get to get some edema. Not everybody, but some people do. So in patients who have any kind of cardiac situation, anybody who's got any CHF, any kidney problems, anything like that, you want to be very cautious because you will get a little bit of fluid retention. And so you have to manage those things and be aware of those things. But
From what I gather, from what you're saying, those three are fairly reasonable, and there's no major red flags as far as like this is really a disaster. I want to ask you about a couple others that it's less clear to me. So the first one is the TB 500, which you mentioned earlier. So can you talk a little bit about that and why? Because I think that it's used similarly to BPC 157. Yes.
yeah, so I will tell you what I know. I will also tell you that is not a very well understood peptide. So TB 500 it's the same. The name that's used interchangeably, thymosin beta 4 is a name that's used interchangeably. We also have thymosin alpha. And so I'll talk about them both a little bit, and I'll say what we know, what I know, and then what we don't. So the thymus, for those of us who are not physicians in the audience, the thymus is a gland that kind of lives in your chest. And when we are young, kids, our thymus is this big, highly active gland. And its job basically is to train and modulate the immune system. And go through the course of our lives, our thymus kind of involutes. It kind of gets like fibrous and turns into fat, and it kind of dies, for want of a better word. It doesn't die completely. Usually you have, I think, 5% activity when you're in your 60s or 70s. But the way that as the thymus kind of goes downhill, our immunity also goes downhill. Kids respond, have these very vigorous immune responses to vaccines or to illnesses or whatever, and they recover much better than people who are older. So there's been a lot of interest in this idea of, well, the thymus seems to be linked to having a robust immune response. A robust immune response seems to be very, very important for a lot of health outcomes. So what can we study about the thymus? Well, the thymus makes a bunch of peptides. In addition to sort of training the T cells and the B cells, the thymus also makes peptides. Thymosin alpha and thymosin beta are the two major peptides that we know of that are made by the thymus. And they interact with the immune system in ways we don't really fully understand. Put that out there first. But thymosin beta, our immune system is highly involved in healing, right? Because when there's an injury, one of the first things that has to happen is you got to go in and you've got to take apart all the damaged tissue, get rid of it so the new tissue can grow. And it's our immune system that does that part of the job. That's why when you get an injury, it's red and it's hot. That's our immune system going to work, right? So the idea behind thymosin beta, and there's not a lot of, there is some in vitro data. I'm not sure how much in vivo data is.
I don't think there's any human data.
I'm not aware there's human data. Thymosin alpha is actually used in humans. It's FDA approved in the US and China and a bunch of Europe. So thymosin alpha is a different category. The idea behind thymosin beta, to the best of my knowledge, is that you are giving it in the hopes that it will allow for quicker and easier removal of damaged tissue from a wounded area. And that's why it's typically combined with BPC 157. It's like BPC 157 is the cranes, in there building new stuff, and the thymosin beta is the trucks hauling away the debris. That's the idea behind it. You are absolutely correct. There's not a lot of data on what it's doing. It does not seem to be hurting anyone in that, the Wolverine stack is the most common peptide stack, I think, of any of them. That's BPC and thymosin. And it's been taken by a lot of people over a lot of time. But there is no human data on that, to the best of my knowledge.
If only we could harness all this non-official.
We could collect data. That'd be so cool. It's one of those things where, the ideas behind this stuff are so magical that I think it's hard for people to restrain themselves. The idea that we can actually harness the body on a molecular level, because our bodies have so many abilities that we just are not taking advantage of, and it's a very seductive idea. I get why people are so excited.
Well, the thing is the reality of, now I have studied a lot about like paleo primal stuff because I've been paleo for kind of a long time.
Oh, I didn't know that.
Yeah. And it's a lot easier to think about taking a peptide than essentially mostly starving for 3 weeks and then, sprinting, killing an animal and eating it all in, a few days. So people in that whole area of the world, of thought, which is not crazy, but like the idea is that our primal ancestors, our bodies are meant to live like that. Mm-hmm. And so what these peptides are sort of promising or offering this potential of, hey, all you have to do is inject this peptide and you don't have to starve yourself and go chase the beast and kill it.
I mean, exactly. It's the idea that all of that stuff is a wasted step, right? You can just go straight to the stimulus. You don't need to have all. And the same idea with with GHKCU for skin. It's like we use a laser, create a wound. The wound creates a healing response, and the healing response creates collagen. Well, what if we just skip all that and just go straight to creating collagen? That's the idea. You don't have to do all that stuff, and it is very seductive.
Right. Okay. Well, so it's so interesting. Okay. I want to cover a couple more, and then I want to get into what's happening with the status of these things.
Yeah.
So one is I have talked about Melanotan 2 previously, and everything I understand, I've seen a ton of videos on Instagram of dermatologists saying, do not do this, and actually showing these melanomas in response to that. Yeah. So increased risk of skin cancers, but it makes you ridiculously tan. Like I've also seen pictures of people who, were white, and they are very, very uniformly dark skinned after using this peptide.
I will tell you, so the melanocortin, so I'm not a huge fan of the melanocortin peptides, but there's a handful of them. They all bind to the melanocortin receptor, right? And that's a receptor that's responsible for a lot of different stuff in the body. It's responsible for pigment in the skin. It seems to have it's doing something with sexual response of both men and women. We don't entirely understand that. And the thing is, the melanocortin, I believe it may be 2, so you'd have to check. I don't prescribe the Melanotan, so I'm not 100% certain, but one of them is an FDA-approved drug. It's Vyleesi. It's the one that is prescribed to females for hypoactive sexual response. The problem is it causes a lot of flushing and nausea. So if you're using it to tan, I don't think that's necessarily a good idea, because stimulating the melanocytes, as you said, not necessarily the best idea in the world. They can be very finicky cells. So
they're very finicky cells. We spend so much time trying to not piss off people's melanocytes. Like that's one of our main goals, is we don't want to piss off your melanocytes with any of the things we do. And that idea of taking a peptide that's going to piss off your melanocytes isn't.
I agree. I think that people should be allowed to do whatever they want to with their own bodies. I personally don't prescribe the melanotans, because I'm like, what are we doing with the melanocytes? And then as far as the sexual response, like there's so many side effects with it that it just does not seem worth it. Like Vyleesi never became a blockbuster drug because nausea and sex don't go together well. So it's just, it's a repackaged medicine that's already been out on the market and hasn't done a very good job.
Right. Okay. So we're very dismissive of that one. Let's push that one away.
It's one that I don't think works for the purposes that people are trying to use it.
Okay. So the last 2 I want to run by you are the 2 that were developed in Russia a long time ago. So Selank and Semax.
Yes.
So tell me about those and why? Just tell me.
That's a great question. There is some fascinating mechanistic science behind those 2. I will tell you that I am not as familiar with them. So I will tell you what I know, but I'm not by any means an expert. But I'll tell you what I know. And they do seem to work in humans. The idea is Semax, or taking a step back, we have a system in our brain called encalphins. And the encalphins are a group of molecules that basically regulate our endogenous opioid system. So when encalphins are upregulated, what you're going to get reduced chronic pain, because you're binding opioid receptors, right, within your own body. So you're going to get a reduced pain response, and people feel very good. And so it brings down stress levels, it brings down cortisol levels, it brings down pain. The interesting thing about this molecule, though, is this is something that I struggle with as a clinician. I'm like, okay, well, it makes people feel really good. You're doing it with your body's own receptor systems. On the other hand, how much difference is there really between this and just doing opiates to feel good? Like they're harnessing the same system. Is it morally okay to on the other hand, it's the same system. It's a runner's high, right? I mean, you activate the system when good things happen to you in life as well, and so it's a physiologic thing as opposed.
Are they addictive the way opiates are addictive?
It does not seem to be addictive. People do not have withdrawal. Now that's a physical thing. Are they emotionally addictive? People like them a lot because they feel good. They feel good on them, and it takes away these negative things. There does not seem to be a physical withdrawal. Selank is kind of similar in that it's going to suppress cortisol secretion. And that I'm not sure how good the data is on that, to be honest. There's a couple papers, saying that there seems to be this correlation. It upregulates or stimulates in some way the endocannabinoid system. Again, not
Mhm.
clear mechanistically exactly what's going on. Humans have been stimulating the endocannabinoid system for millions of years. This is something that
Right.
humans do a lot, and it makes them feel good. And there doesn't seem to be a lot of really bad long-term effects from it. But
Neither of them is supposed to enhance cognitive function. I thought that was kind of a big
I have
deal.
heard people talking about that. I have not seen any reasonable mechanistic data that shows that is true. I also have never used these personally, so I really can't speak to that. I can't see from the mechanistic studies that I've read, which again, they're from Russia and there's not a lot of them. I don't see a mechanistic way that happens.
How that would happen, other
Not
than
saying that it
to
couldn't, but
reduce stress, maybe
Sure.
reduce anxiety.
Yeah, I mean, if you reduce anxiety and
Aware.
stress, the frontal cortex works better. Like that is the only way I could see that working. But that is true. Like when people are scared and stressed, they don't think.
So presumably they would reduce pain. I mean, is there a role for using that in chronic pain?
They are used in that that's a pretty common reason to use them, but is to treat chronic pain. They seem to have a pretty good effect. Now, that being said, placebo also works 20% of the time, and there are no big human trials. And so does it actually have something beyond placebo? It's not really known. The only thing we know is that encalphins and endocannabinoids do help regulate pain inside the body. We know that to be a thing. But beyond that, I mean, we don't know a lot about them. They seem to make people feel good. People seem to like
Okay.
it. That's
Interesting.
that's
Okay, so let's talk a little bit about what's happening legally with these things, because none of these is FDA approved in any way.
Not true. Tesamorelin, FDA approved.
I was talking about the ones that I've asked you about. A couple of them have been on the list for the anti-doping agency, forbidden, which I find also very interesting, because that you said earlier, well, it must be doing something if they made those off limits.
If they bothered with it, it probably was doing something.
So what happened was, these were available for compounding for a long time. And then in 23, the FDA banned them and said they were dangerous.
Made them category 2. So basically moved them from category 1 into category 2, with category 1 being not FDA approved, but available for compounding. And then category 2 is not available for compounding pharmacies. So what people have done to get around that, and to be fair, and I'm gonna just speak frankly for 1 minute, not saying that we know everything about them, but speaking about BPC specifically, I have, for myself, and also I have many patients where it has made life-altering changes in things like arthritis. I have several patients who have Ehlers-Danlos, and it has made significant life-altering changes for them. And which makes sense mechanistically. If you have, if you're hypermobile and you're tearing up your collagen all the time, I told these patients, I'm like, listen, I don't know what the long-term effects of this drug are. I don't. No one does. However, we know what your life is like now. And this is a choice that you make, understanding that I can't tell you 30 years down the line something horrible may happen, but it may help you now. And I have several patients who have tried it, and it's made significant difference in their function. So when the peptides were moved from category 1 to category 2, there was, some of them are, I think, fluffy lifestyle fun. And some of them really can make some big differences for patients. And so there was a really strong push for people to still have access, especially to BPC and the growth hormone secretagogues. So what people started doing is they started making them in labs and selling them as lab compounds as opposed to medications. Same people doing it, same manufacturing facilities, same molecules. But now they're doing it under the regulatory pathway that governs supplements instead of under the regulatory pathway that governs meds, because that door was closed. And so that happened. So now what you got lab grade. Some of it's very good, some of it's not. There's no way to know. There's not as much oversight. Is it illegal? It's not illegal. You can make a compound and be like, this is not for human use, and give it to someone and be like, I don't know what happened.
Well, hold on though. Hold on.
Yes.
It's illegal for it. I mean, if you take a medicine, anything, and inject it inside a human, that is the practice of medicine.
Well, but if the human does it to themselves,
if the human does it to themselves, that's just, we could do whatever. I mean, you can be, inject
this stuff
dirty.
is generally done, exactly. It's done by patients at home. Yeah. So,
No. So, but what I want to be clear though is that, like, so if you order it, do it to yourself, that's one thing. But if you are some kind of purveyor of these things, right? So as a physician, I'm allowed and you are allowed to practice medicine.
Yes.
And we are actually allowed to prescribe things that are non-FDA approved. However, we're held to a standard of care.
We bear the consequences.
If something goes wrong, we're responsible. And we're held to the standard of care. So if you're doing something really fringy and you hurt somebody, then you're in big trouble and you could lose your license or you could be sued for malpractice. So, but let's take, say, someone who cannot practice medicine, either a lay person who's a business person or say like a nurse who can't practice medicine on their own. If they order these things laboratory grade and inject it into a human, that's illegal. That's actually a felony because they're practicing medicine without a license.
Well, I mean, and this, I'm not exactly sure of the legal question here, so I'm not going to pretend I know.
Well, I just reviewed a case that I'm about to do a recording on, which is exactly that. But this particular nurse ordered semaglutide that wasn't, that was laboratory grade, basically.
Semaglutide is still a medication, right? So semaglutide is still regulated by the FDA because it's in the medication category.
But anytime you cross the skin barrier with a needle,
true.
That's the practice of medicine.
Is that true when it's actually something which is not a medication? So Ford, let me ask you this.
It is actually.
Injecting B12. B12 is a supplement. You don't need a license to inject it.
Well, actually,
again, I'm not a lawyer.
Yeah. So, I mean, I've been putting together a legal compliance course, and I've lectured now a couple times to lawyers about healthcare law, med spa law. And so actually, if you break the skin with a needle, a human taking a needle, putting a needle into another human past the skin, that's the practice of medicine. So for instance, estheticians can't do microneedling or whatever because they're breaking, they can't do that.
I mean, are you sure that is true?
I'm 100% sure. This is
Colorado. They're allowed to do that in Colorado without a medical director.
No, there are. No, you can't inject somebody. They can inject themselves and do whatever you want, but also you can commit suicide. That's technically probably not legal, but it is absolutely true. If you stick needles into people and put something in them, you're invading their body and giving them a substance that you're intending to do to change the bodily function with it. That is the practice of medicine.
I feel like it seems like there must be carve-outs in that for supplements because people inject supplements all the time. And not saying that they're not breaking the law because there's laws out there that people just ignore. But I would assume that only counts for things which are considered medications.
I can only tell you that is, I've been over this with several healthcare attorneys. And, because people are getting all kinds of things off the internet, right? And some of these things are knockoffs of real drugs and other things are completely, not drugs at all, right? You can, let's say you inject concrete in someone to give them a butt lift. That's illegal. That is it's illegal for so many different reasons. It's not just illegal because it was a needle or a big needle probably, but that's happened, right? That has happened. So to say that it was a supplement and not a drug, that's like saying, well, concrete is not a drug, so therefore it must be okay.
And definitely it's illegal to inject spackling into people. There was that case in Vegas. I saw that,
Yeah, that's a real case.
That's a valid one. But I think that generally speaking, these are used by people injecting themselves. But okay, right, valid point.
Yeah, I mean, the first really I learned kind of a fair amount about this was from a completely different podcast that was just talking about peptide stacks. And where everyone's getting them because they can't get them from the legal places anymore. So they're buying them from China. Most of the peptides that people are self-injecting, they're buying from directly from China.
I just mine from a compounding pharmacy. So there are compounding pharmacies that still do it. They just do it. It's something that is very quiet and not on their websites. But you still get it from like the legit, but you can still get them from sterile compounded sources. I agree that a lot of people get it from China. That's probably not a very good idea.
So this is also very interesting because There was two speakers from the FDA at the AmSpa meeting recently, and they talked about this, and I grilled them for about an hour and a half afterwards. And basically, there are FDA approved manufacturing facilities that are allowed to make the substance in the first place. Okay. And then there's FDA approved compounding pharmacies. So generally the compounding pharmacies buy the substances from the FDA approved manufacturers.
Yeah.
And then generally doctors, prescribe something for their patients from a compounding pharmacy. So doctors are allowed to compound. I don't know if that's true in every state. It's definitely true in Washington. So it's like, okay, so if a doctor orders from the FDA approved manufacturer and then compounds it for their patient, is that legal? And they were like, yeah, well, I don't see anything wrong with that.
Seems like it would be. I mean, there's so much.
Totally legal. So I'm like, oh, okay, that's kind of good to know. So the thing is, if you're not a doctor, though, you can't compound, or unless you have a compounding pharmacy license. Yeah. So, if you're a nurse or if you're a layperson with a business who owns a med spa, that's probably illegal, and you order from one of those things, no, you cannot compound because you don't have the license to compound. But I think, the reason I wanted to talk about like how illegal is it is because there's all these little subtle gray areas in it. And the thing is that, it's legal to buy it yourself and self-inject, but it's not legal you can't make money buying it illegally and then injecting it into people, especially if you're not a doctor. No, if you are a doctor, you can buy it from a legit FDA-approved facility and inject it in people. You're still taking a risk because you're using your medical judgment and a full disclosure with that patient, right? You're taking a risk. Like if anything goes wrong, your butt's on the line. But there's everything, all this in between that's really hard to assess, like who can do what and where is it coming from and how do you know? Because I think the biggest thing is I do not want to put something in my body where I don't know where that came from. I don't, it could be contaminated with bacteria. It could be an entirely different substance. And all these things have been documented over the last few years with all kinds of different products, not just Botox or Ozempic, but like all these different things where people have gotten horrible infections because, it was a contaminated product. People have gotten very, very bad allergic and inflammatory reactions because it was laboratory grade with other stuff in there that wasn't meant to be put into humans. And then there have been people who have almost died because it wasn't that substance at all. It was something else. Like there was a case here in Seattle where someone almost died because they had gotten Ozempic, fake Ozempic off the internet. And it wasn't Ozempic, it was insulin. And this person this person almost died from hypoglycemic shock, right? So
that's a big difference.
Really big problem, right? So the problem is like if you do not know where this thing came from, do not put it in your body, right? And so I do think that having a physician like you who really knows their stuff and knows where it's coming from and can vouch for it and can monitor it and also manage if there's any problems. I think that's really, really important. As we start getting into like people are going to, with this FDA decision, people are going to really start doing this more and it's going to be a lot more.
So, I mean, you're talking about the board in category 1?
Yeah. Well, there's 12 of them that they're saying that, I think that the timeline was July or August that they were going
to. The July meeting. And I think there's 15 on the list. And it was the BPC definitely was there, the GHKCU, the thymosin, both the thymosin molecules, Selank, I think was. And yes, I think if it does go back to category 1, which I think, they've been telegraphing that they think it will. And, that our RFK definitely also telegraphing that he thinks it should. And if that does, then I think that will be a positive thing because if people are going to do it anyway, it should come from a sterile compounding facility that has certificates of authenticity and purity testing. Like the place I get my peptides from, I mean, they purity test each bottle and there's the lot number on the bottle. You can go to their webpage, you can put the lot number in, you can pull up the purity and COA testing on every lot. And that's what it should be. I mean, if given all the things we don't know about these molecules, we should at least know that. So I think that would be a good thing. I hope they do it. because people are crazy and they're going to do whatever anyway.
I think so too. I mean, I'm not the hugest fan of the current management of the FDA, but I think that what happens when you make things illegal is that people go underground and things get more dangerous. And I can only like this. I know this is going to be a remotely related, but when I was in college, the drinking age across the country went from all kinds of ages at different states. New York was 19 to 21 universally my freshman year of college.
Yeah.
And where everybody had just gone to keg parties before, now most of the people in college no longer were of age. And what happened back then, this was in the 80s, people started drinking way more hard alcohol and getting way sicker. And I actually had a classmate who died of alcohol poisoning because he couldn't just go to a kegger. And he and his roommate split a bottle of tequila and one of them didn't wake up. But I feel like this is, I mean, I know it's kind of like a stretch, but I think this is very similar to that because, you drive things underground and then more and more dangerous things happen.
If one thing, if we've learned anything about prohibition over the years, is that it tends not to work very well.
Right.
Things that people really want, they're going to find, regardless of whether it's good for them or not. So I agree with you. I would much rather have it be much more highly regulated and much more above board. That'd be good for all of us, I think.
So for anybody out there who's really super stoked to try peptides, maybe wait until this happens. But for sure, if you're going to try them, I would do that with a doctor who's super smart, like Dr. Waples here, who can really guide you through it and help figure out like if it really is going to be helpful and make sure it's safe and make sure that product is safe.
And also, any peptide that you get from any source, if you can't get lot number based purity testing and proof that there's no contaminants, proof that it is in fact a certificate of authenticity that says this is in fact the molecule that's in this bottle, if you can't get that from whoever's supplying you, whether it's a company or an individual, if you can't get that kind of testing, you really should not be injecting it. Like Kate said, odds are probably good, it'll be fine, but you don't want to be that one person where it's not fine. So don't inject anything that you can't get purity testing on and a certificate of authenticity showing that it is what it's supposed to be. That's baseline.
Well, Flora, thank you so much for talking with me today about this. It's been so interesting. Hopefully people found that really helpful.
I hope so. I feel like I answered a lot of the questions with, we don't know. But that's
okay, because that's the truth. And that's what you don't get from all the hype people. Yeah. All right. Well, thank you so much. Next time we will talk about something. All right. Bye-bye. Thanks for listening. If this episode opened your eyes to something you didn't know before, share it with someone who needs to hear it. Subscribe so you don't miss the next one. And drop a comment telling me your biggest takeaway. I actually read them all. Join me on this mission to keep you safe and push this industry to do better.